Hi, everyone, and thank you for joining me today for episode 728 of People Behind the Science. In honor of World Thrombosis Day coming up on Friday, October 13th, we are excited to rebroadcast our interview with Dr. Alex Spyropoulos, originally published on November 13th of 2017. Listeners, Dr. Spy is a thrombologist who studies venous thromboembolism primarily in the lungs and legs. These blood clots can cause morbidity and mortality, and many people aren't familiar with the risks, common symptoms, or the situations in which clots may occur. So Dr. Spy is dedicated to raising awareness of the risk of blood clots to help save the lives of people around the world who may have existing clots or are at risk for developing them. And in our interview, listeners, Dr. Spy talks about his research as well as his life outside of science. So I hope you enjoy this episode of People Behind the Science.
Every day, discoveries are made that will change our understanding of the world around us. Dr. Marie McNeely is here to bring you the brilliant minds who are making these discoveries so they can share their incredible stories and take you on an amazing journey. Welcome to People Behind the Science.
Hello, everyone, and welcome to People Behind the Science. Listeners, today I am excited to introduce you all to Dr. Alex Spyropoulos, aka Dr. Spy. So, Dr. Spy, welcome to our program today. How are you?
It's a pleasure to be here.
Well, we are delighted to chat with you and to learn more about you and your work. But listeners, let me take a moment first to introduce you to Dr. Spy and let you know a little bit about him. Dr. Spy is a professor of medicine at the Hofstra Northwell School of Medicine, as well as a system director of anticoagulation and clinical thrombosis services for the multi-hospital Northwell Health System. In addition, Alex is a professor of the Merinoff Center for Patient-Oriented Research as part of the Feinstein Institute for Medical Research. Dr. Spy received his MD from the University of Pennsylvania School of Medicine, and he completed his internship and residency in internal medicine at the University of New Mexico Health Sciences Center. Dr. Spy is a recipient of the Lovelace Clinic Foundation Excellence in Education Award, as well as a fellow of the American College of Physicians, the American College of Chest Physicians, the International Academy of Clinical and Applied Thrombosis Haemostasis, and the Royal College of Physicians in Canada. Now, today, he is joining us to talk about his life, his research, and his medicine. So, Dr. Spy, we want to get to know you both as a scientist and a physician, as well as a person. So, can you start by telling us what you like to do when you're not doing medicine and research?
I can think of many, many things that I love to do. The only trouble is the lack of time to do them all. But I think the things I love to do the most is be with my family. I have a 5-year-old son named Philip, a 3-year-old son named Stefan, and a lovely wife named Yelena. So when I'm not doing research, I love to spend time with the three of them.
Wonderful. So what are some of the family's favorite activities these days?
The favorite activities at this point, because it's this time of the year, is to go and pick some apples up in the Northeast where we live. That always is a fun activity. Maybe a ride in the hay truck is always a blast, as well as pumpkin carving and apple carving, which now my eldest is really starting to get into. And then lastly, we're right around the corner from Halloween. So this is an especially exciting time.
Do you get pretty into Halloween yourself?
Oh, yes, absolutely. I didn't need much to push me over. So, yeah, I love Halloween myself.
Can you reveal what your costume is going to be, or is it a surprise?
Oh, it's a super top secret surprise, but it will involve ghouls and skeletons and ghosts.
I like it. Well, Dr. Spy, wonderful to get a window into your life outside of work. But I do want to chat a little bit about your work next. So can you tell us how you describe what you do to someone who's not at all familiar with thrombosis or the field that you study?
Yeah, I think that's a very good question. I would describe myself as a thrombologist, and I guess because of my Greek background, I can actually say that word. So really a thrombologist is a clinician and researcher who's interested in the study of thrombosis. And really thrombosis pertains to blood clots that some of us may be at risk for or have existing blood clots. And again, because there are existing medical specialties such as cardiology, who takes care of heart attacks, and neurology that takes care of things like strokes, clots in the brains, my particular focus is on venous thromboembolism. So these tend to be blood clots in someone's lungs or legs that can either have morbidity or in some cases mortality that could be fatal. So this has been really my life's work for the last 20 years or so.
Excellent. I think this has big impacts on society, and working in this type of area of medical research can be really motivating in and of itself. But I love learning a little bit more about what motivates researchers. So do you have a particular quote that really stays in your mind as you're doing your work, or a motivational force that keeps you going in every day?
It's interesting, but there's a great quote, and this is an anonymous person that says, science is built up of facts, right? As a house is built up with bricks. But really, the thing that makes science is the same thing that makes a home as opposed to a house, which is how you put the bricks together and how they form together collectively to make a house or home. And I think with science, the key for me is perspective, as you said. Why do I love what I do? And the reason is twofold. There's a personal reason as well as an intellectual reason.
I like it. Now, can you tell us, were there particular people along your journey, or maybe at the very beginning, who first inspired you to pursue this path, or maybe served as role models for you along the way?
Absolutely. When I was a young hospitalist in Albuquerque, New Mexico, I was starting my really nascent Coumadin clinic at that point. And also, we were starting one of the first outpatient DVT treatment programs at the time. This is really in the mid-90s, which was both exciting but also very challenging. Because at the time, many of my colleagues thought it was impossible to treat blood clots with agents in the outpatient setting. It really was an inpatient disease. So I set out to prove them wrong. Mm-hmm. And I think because of my background being at Penn, I always loved research and science. I had a very strong scientific background. So we invited, at that point, a very famous guest speaker. The name is Professor Graham Turpey, who was extremely well known, one of the giants in the field, and still is. He was set to give the keynote celebration, and I was going to give the talk about my little small 100-patient clinic. Mm-hmm. Unfortunately, because I talked for 45 minutes giving data on my 100 patients, he only had about 5 minutes to talk about the 3,000 patients worth of data that he had.
Oh, no.
And of course, I was mortified. But at the end of the day, he took me to a side and he goes in a very Scottish accent, "Vladia, I don't know who you are and what you do." And he goes, "You don't have a lot of data, but you have a lot of spunk."
I like that.
And ever since then, he was really my conduit to the field of venous thromboembolism. And I really became enamored with this field because it was what I call a poor second cousin. No one seemed to take it seriously in the medical field. What I mean by that, there was not a dedicated medical specialty. All the specialties had a piece of the pie, whether it be orthopedic surgery or general surgery or hematology or internal medicine, but no one quite had the entire picture. This is when I became very close intellectually to a group of clinicians and researchers at McMaster University, which, by the way, I'm actually at right now as we speak.
Very cool.
I just finished a Grand Rounds lecture at McMaster University in Hamilton, Ontario, Canada, which really became the epicenter of patients with thrombotic diseases and clinical research. So that really began my journey. And then I have two other considerations that followed very closely. I became very interested in thromboprophylaxis of medically ill patients because one of my patients when I was a hospitalist was named Willard Wonka. And this really piqued my curiosity. And Willard Wonka was an elderly male who had intrinsic lung disease. And I got to befriend him over time. I was his treating physician. I gave him the then known blood clot prevention strategy, which is giving heparin twice a day. And every day I got to know him a little bit more and more. And he shared his fascinating story with me, which he went as a tail gunner from the U.S. to the Royal Air Force in World War II during the Battle of Britain. And this is before the U.S. entered the war. He was shot down, I believe, and was convalescing. And during his convalescence from his wounds, he met an RAF pilot from the Royal Air Force who told him a fascinating story about a chocolate factory, how this RAF pilot, because there were so many orphan children in London at the time because of the air raids, his idea was to build a chocolate factory, and every month he would include a free prize within chocolates that he would give to the children, and that prize would be to tour the chocolate factory. And I think we know now that Dahl, the author of Willy Wonka and the Chocolate Factory, was also involved in the Royal Air Force. So to me, it's probably not accidental that this patient who I treated named Willy Wonka was associated with a chocolate factory in the UK.
Oh, that's so cool.
So Mr. Wonka, about 5 or 6 days after hospital discharge, succumbed to a fatal lung clot event. So he had a fatal lung clot. And I was mortified because I was his treating physician. I did everything right at the time, and he still died of a lung clot after he was discharged under my watch. So that really piqued my curiosity for what I could have done better at the time. And in hindsight, it was likely because probably we didn't give enough duration of prophylaxis for clots. At the time, this is early 2000s. So that really spurred my interest from an academic and clinical research point of view into the realm of VT prevention for medical patients.
Well, I think these patient stories can have such a big impact on you in your career. I'm curious, though, before you started medical school, you mentioned you were at the University of Pennsylvania for your MD. What really sparked your interest in science and medicine to pursue that to begin with?
I'd have to say it's my dad. My dad was a very well-known interventional radiologist. Actually, he was a pioneer in what he did in interventional radiology at the time. He was one of the early ones in New York City in the 60s. So he kind of spurred me because he saw something in me that I probably recognized later on, which is a love of science and also a deep curiosity and a love of medicine. I really did love medicine. I have to say that medicine came very easily to me, especially the biological sciences. So I have to give him a lot of credit for that.
Wonderful. Well, it's great to hear more about your beginnings. But Dr. Spy, I'd love to hear more about what you're working on right now. So is there a particular project you want to tell us about in a little bit more detail?
Yes, this is what I like to call my third child, which is the global Mariner trial. And I'm very privileged to be what we call the co-global investigator for this trial. And this trial is in many ways probably one of the more innovative trials in the field in the last 30 years. And it really aims to answer a simple question, which is the strategy of extended prophylaxis after a medically ill patient leaves the hospital worthwhile? Does it provide benefit? In other words, does it decrease clots in the lungs and legs? And importantly, does it decrease fatal clots with no excess bleeding events? That's been a very important question, and frankly, a question that until recently has been unanswered for over, I would say, 25 years.
Interesting. Now, you mentioned this is a global trial. Are there sites across different countries? Can you tell us about that?
Sure. This is a trial involving, by the trial's end, about 12,000 patients across 36 countries and nearly 1,000 medical centers. So really global in scope and design.
Very impressive. Well, it sounds like a worthy undertaking, and a lot of challenges, I'm sure, are associated in working on this kind of large-scale global trial. And I love chatting about some of the challenges that people encounter in science and medicine, because I think it's so important to show the public kind of the realistic, holistic picture of what life is like, including some of these challenges. So, Dr. Spy, do you have a failure or a challenge of your own that you want to share with us today and talk about how you're working through it?
One of the more challenging things that I have found in the conduct of clinical science and doing these kinds of trials is getting the patient involved in the trial, is really discussing the trial and making that patient who's ready to sign a consent form understand the importance of the trial. And that's really been one of the more challenging aspects I find. I think, unfortunately, there's been a little bit, whether it's because of media or maybe a disassociation from the doctor-patient relationship, less trust amongst patients and clinical researchers that was, let's say, we had 20, 30 years ago. So one of the tasks that I have is really to reestablish that trust at a patient level.
Sure. So what do you find helps with reestablishing that trust and getting people to really understand what they're signing up for?
I think the most important thing is trust. And as we both know, trust evolves over time. And I find that the patients have very good barometers of trust as long as you explain the situation openly and frankly and really discuss risk benefits. I think it's important to patients to understand why you're conducting the trial and what the endpoints of the trial are.
Right.
So the question that patients ask me is, why should I be doing this trial? And the answer is because we think at the end of the day, we can either help you or someone after you to avoid potentially a fatal lung clot event, such as my patient had over 15 years ago. I bring that past to discussions with patients because that really stays on my mind. As a physician, you have what we call sentinel events that you carry with you. throughout your whole career and your whole life, really. And the passing of Willy Wonka for me was one of those sentinel events that I'll never forget. So yes, I carry that event in my mind's eye when discussing with the patient, and I find that that's very helpful as we work through why we're doing this trial.
Certainly. And I think within your field in general, it seems like there might be a disconnect in terms of the public knowledge and the education pieces of it. So what sorts of, initiatives are going on, or what sorts of things do you think can be done to help people learn more about the risks and what they can do about them?
Absolutely true. So the patient education aspect, I can't stress enough how important it is. I think from a public health perspective, patients now are well versed with cancer. Cancer is what I call a very high-profile disease, and it makes everyone's breath stop when they hear the word cancer. I think more and more patients have greater knowledge with respect to heart disease and greater knowledge with respect to strokes. They understand the fatal implications of having a heart attack and either the fatal or debilitating implications of having a stroke. So that's more and more, I think, well established in the public eye. What we have in venous thromboembolism is essentially an orphan disease. So an orphan disease meaning that after what we call heart disease and stroke, it is the third most common cardiovascular disease globally. And yet there's an extremely low patient awareness of this. So there's low awareness about the signs and symptoms of blood clots. There's also low awareness of the potential fatality of having a blood clot. So the first thing, as you suggest, is spot on, which is really raising the public awareness, both nationally in the U.S., but also globally.
Certainly. And I understand that a day has been established, quote unquote, the National Thrombosis Day. Can you tell us a little bit about that?
So October 13th is a National Thrombosis Day that I think it's no chance that it also corresponds to Rudolf Virchow's birthday. Mm-hmm. So I think it's an important first step in establishing venous thromboembolic disease, which are really blood clots in the legs and lungs, as a disease of national importance and really bringing it to the public eye and patient awareness. So I think having a set day for that is important. We've seen such strategies, for example, in breast cancer awareness, in stroke and heart disease awareness. And I think the next steps are really educating the public as to, number one, the signs and symptoms of blood clots, and number two, recognizing the potential risk factors in developing these blood clots, whether they're in the hospital or out of the hospital.
Certainly. So if you had to briefly outline some of these key symptoms for our listeners out there, I know we've heard about the dangers of blood clots when you're sitting on a plane for a long time or things like that. What are some of the circumstances we should be watching for, or some of the symptoms?
Blood clots rarely present spontaneously, although they can. If you pry enough, there may be either antecedent risk factors or patient conditions that may, again, add to that risk. So the first thing I would ask a patient is, do they have an underlying either heart or lung disorder that may put them at risk for getting blood clots? And a good example is heart failure, mm-hmm. or emphysema, or if a patient has a chronic infection, or if a patient has chronic inflammatory disease, such as inflammatory bowel disease, ulcerative colitis, etc. And lastly, cancer. Cancer itself constitutes a high-risk feature for getting blood clots. So the first thing I tell my patients, do you have one of these 5 or 6 or 7 diseases per se that puts you at an elevated risk of developing blood clots? Then the second thing I ask is, are you in a particular situation that would add to that existing risk? So if you're in a plane flight, especially an over 7-hour plane flight, you're immobile for a long period of time. We know that immobility is a risk factor for getting blood clots. The second thing is age. So elderly patients in and of themselves are also at risk for getting blood clots. Whether or not they have underlying what we call medical illnesses as well puts them at an increased risk. And then I think the third important aspect is a history of disease. So is there a history of blood clots either within yourself? Have you had a prior history of blood clots, or within your immediate family? And then lastly, what we know in medicine as thrombophilia, which means a genetic or acquired tendency to form blood clots. So do you have one of these genetic risk factors? Factor V Leiden is one of them, or prothrombin gene is another. But do you have a genetic tendency to form blood clots, or do you have an acquired tendency to form blood clots as well? So these are some of the key risk factors and elements that contributes to an overall patient risk. And then in terms of recognizing that risk, the problem with blood clots is a lot of times the symptoms are nonspecific. So in a patient, for example, they could present with redness and swelling of an extremity of a leg. If they have a lung clot could be a very subtle presentation, such as worsening shortness of breath, especially if you're walking up a flight of stairs or you're walking a fairly long distance. Also, they have a deep pain when they take a deep inspiration. That's another worrisome sign. And of course, sometimes things like fevers and chills could be other markers. And hopefully, if a patient is spitting blood, they'll recognize that that's a very bad thing and they should see a doctor immediately.
Right. Seek help. Yes.
Yeah. So I think what's important is really recognizing the conditions that put you at higher risk. And then if you do have a symptom, the ones that I described, even in a very nonspecific way, alerting your physician to that, I think becomes important. The other aspect that we didn't talk about is post-surgical patients. Mm-hmm. So if a patient is discharged from a hospital, either because they have a medical condition or because they've underwent surgery, such as general surgery or orthopedic surgery, and they have the symptoms that I described, that also constitutes a high-risk period, about 30 to 45 days after they've left the hospital. So just be aware of that. This can potentially be a high-risk period as well.
Certainly. Well, Dr. Spy, thank you so much for adding to our knowledge on blood clots. And we've talked about some of the challenges that you are facing in your field today in communicating with patients, getting people to sign up with trials, and just general education for the public. But I don't just want to chat about the challenges. Can you tell us next, Dr. Spy, about one of your exciting successes, whether it was a big win or a small victory that just really meant a lot?
Well, like any other clinical research, I've had my share of failures, but I've also had my share of successes. So I put them in two buckets. One bucket is what we call a success in terms of the way we deliver medicine. Mm-hmm. And the other bucket is a success in conducting a clinical trial. So to answer the first question, I think one of the large successes that I could look back is really establishing a very robust Thrombosis Center in little old Albuquerque, New Mexico at the Lovelace Medical Center. We are really pioneers in establishing one of the first outpatient DVT or deep vein thrombosis treatment clinics there in the mid-90s, subsequently established an outpatient bridging clinic. And thirdly, we established a very robust thrombosis center where we started from about 300 patients. And by the time I left, we had nearly 4,000 patients.
Oh, wow.
An entire hospital wing and about 14 hospital employees managing patients with thrombotic disorder. So that was very exciting.
That's incredible.
On the clinical trial side, I think my most exciting accomplishment to date, I was very privileged to be on the steering committee of the Bridge trial, which was published in the New England Journal of Medicine. And for the first time, it showed us that if we use heparin as a short-acting blood thinner, when patients stop their warfarin, which is a longer oral blood thinner for an elective procedure, that the use of heparin actually adds harm and no benefit. So what we've done, and from a global perspective, is simplify the way patients on warfarin are managed in periprocedural settings. Because now what it means is the patient simply stops their warfarin a certain number of days before their procedure and simply restarts their warfarin after the procedure, with no need for the use of these heparin injections, which we call bridging. And from a public health perspective, I think, again, that was a major coup in conducting this very difficult trial, I may add.
Certainly. So it sounds like your research in these thrombosis centers that you've established are really having a big impact relatively immediately on patient care in people's lives. So what is that like, being able to really see the implementation of the work that you're doing?
I think you're speaking to the choir, because I've always known that this could have a major impact. These kinds of thrombotic centers or anticoagulation clinics, if you will, have a major impact in global patient health. I think the key here is funding. So the problem that we run into is one of funding, both at the health system level as well as at the federal and other levels of funding for various clinical trials. So I think with maybe greater public awareness, we may be able to establish greater funding mechanisms for these types of centers, especially with what I call the orphan disease, venous thrombosis. which is still the poor second cousin of patients with heart attacks or strokes. And that's the major thing, is really putting this disease in the forefront from a public health perspective.
Now, we've talked a little bit about your life outside of science, and you mentioned that you are being kept quite busy by 2 young children at home. But I do love talking to all the researchers we have on our program about some of the books that they've read or the books that they are currently reading and enjoying. So, Dr. Spy, do you have a book recommendation that you can share with us today? And this can be a science book or a non-science book.
Sure. I think one of the more interesting books that I've read, and actually that inspires me more and more, are really the poems of Rumi. And Rumi was a Sufi poet of the 13th century who lived in Anatolia. So from a very personal level, I love the poems of Rumi, and that would be my suggestion. It's the closest thing you'll come to meditation or reading a book.
Excellent. Do you typically find yourself drawn to poetry?
It depends. I think lately, yes. And of course, with the stresses of work and the stresses of commuting 2 to 4 hours a day to work,
oh, wow.
and the stresses of having 2 little kids, I think it's really important to take that step back and meditate in any way someone can.
Certainly. And I know balancing time, family, work is a concern for a lot of aspiring physicians and a lot of aspiring scientists out there. So how do you balance this really long commute, the family, the clinical trials, the physician work that you're doing?
Very delicately. How's that as an answer? It is. It requires work every single day. And I think the key is to discipline your time so that you maximize the time that you have. I think that's what it really comes down to. The other thing that I love to do that I did describe is sailing, as well as snowboarding and mountain biking. So as much of the time, and I can involve my little ones in the sailing experience. So that's another way that we kind of tune out and get to experience the beauty of water.
Absolutely. Maybe a couple more years and they'll be ready for mountain biking and snowboarding, right?
I'm hoping so. I actually am a big mountain snowboarder myself. So when I was younger, I used to get helicoptered in places like Alaska and go down big mountain faces. So I still love that, although my wife doesn't quite allow me to do that anymore.
Right. You have to take the appropriate safety precautions as well, right?
That's right. Exactly.
Well, we chatted about some of the places you've been able to travel for your training, these different institutions you've worked at, and mentioned that you're actually on the road right now giving a grand rounds at a different institution. And I know there are many opportunities for scientists and researchers to travel. So do you have a favorite place that your work has taken you, Dr. Spy?
My favorite place is my home country of Greece. I think because of the Mariner trial and because of collegiality with my Greek colleagues in cardiovascular medicine, I get to travel there quite a bit. And it still is the country of my birth. It still is a country I'm very connected to. It's one of the more beautiful countries in the world from a nature perspective, and it has some of the most beautiful waters in the world. So it's hard to beat Greece, although I am biased with a name like Spyropoulos.
Right. I was going to ask if that was home for you. Sounds like it, yeah. So now for this global Mariner trial, where within Greece are you situated?
We actually have, I believe, nearly 15 centers situated all over Greece that are part of the Mariner trial.
Oh, wow.
It truly is a global trial with multiple centers all over Europe, including Greece as well. But of course, we have centers in South America. We also have centers in Australia as well. So this is truly a global outreach trial.
And now, if any of our listeners out there are planning a trip to Greece soon, Dr. Spy, do you have any recommendations of what they absolutely must see while they're there?
Yes, they should absolutely see the new Parthenon Museum in Athens. It's spectacular. And of course, if they're going to go to Greece for the first time, they should go to Santorini, which is one of the more epic and beautiful and noteworthy islands of the Greek archipelago. So those would be the 2 places that I would give my big thumbs up.
Wonderful. Well, listeners, we're going to have to add these to our bucket list of places to visit before we die. And we've chatted a little bit about some of the people you've been able to work with and some of the people in particular who inspired you to pursue this profession. But I think the people that you work with as a researcher and in medicine are one of the wonderful aspects of the career. And I think there are some stereotypes out there about what researchers are like, but we try to break those on our program to show our listeners that there's no one mold that every researcher, every scientist has to fit into. So, Dr. Spy, do you have maybe a story or a memory of a quirky tradition or just a funny situation or a memory that you've shared with colleagues that can kind of show this more human side of science and medicine?
I have a few funny stories, but I think one of them was with my fellow. I was introducing him here. I'm actually here in Hamilton, Ontario. And I was discussing with him all of the steel mill factories that existed here in Hamilton. I'm actually a nature lover myself, so I'm not particularly fond of steel mill factories. And my fellow, much like myself, was also very much a nature lover, very much a snowboarder and mountain biker. So when we actually went upstairs to the roof of the hospital, he took this beautiful view in of the deep nature in the escarpment here in Ontario. And he looked at me and he said, I don't see any factories. And I looked at him, I said, well, I think you're looking in the wrong direction. Why don't you turn 90 degrees to your right? After which he did, and ultimately saw about 50 steel mills.
Oh, wow.
And at that point, he said, okay.
It's a different picture. Yeah.
It's a different picture. You're right about that. The other aspect I remember fondly is when we were traveling to Mexico together. This was a very long ride, and we were going to go mountain biking on a canyon called Copper Canyon in Mexico. So we had a long time to speak together. And he and I were discussing the coagulation cascade in 3 dimensions. And I can tell you that that was one of the more interesting rides that I've ever done, is trying to ride through Mexico, through the Mexican border, all the while trying to keep a very serious conversation about the coagulation system, which is one of the more complex systems that we have. So that was another memorable time. Of course, we were interrupted along the way by federales and other agents reminding us that we have to bring our passports and reminding us to get out of the car and search the cars and all that.
Keep you focused, yeah, right?
Keep us focused, exactly. But I think the beauty of clinical researchers is that they're very much people. They have beautiful needs and wants and hobbies. And I find some of the more interesting people in the world.
Certainly. Now, you mentioned having this conversation about anticoagulation events in 3 dimensions. I'm envisioning like hand gestures and props. Is this what actually happened?
That's exactly what would happen. These are all in hand gestures. And again, I'm trying to keep one hand on the steering wheel, whereas, again, given my Mediterranean background, I tend to get very excited when a new concept or something needs to be explained. So the joke is, how do you close the mouth of a Greek? And the answer is you tie their hands.
Yeah.
So yes, it very much involved the use of hand gestures on my part as well. The problem is that I was driving at the time.
Right. I can completely empathize here. I'm a wild hand talker myself. I have to sit on them to keep myself from flailing sometimes. Wonderful to hear about some of your stories with your colleagues. And we've chatted about some of the amazing work that you're doing right now. And I think there's always something standing in the way between scientists and the big questions that they want to answer. So Dr. Spy, I'm curious, if I gave you everything, all of the funding, all of the staff, all of the technology, took away any feasibility constraints, is there one question that you are just dying to answer right now?
The biggest question that I'm dying to answer is, there's a large group of patients with chronic medical illness. And these are patients that are not necessarily in the hospital, but they're elderly. They have multiple comorbidities. They may be in long-term care facilities, or they may be taken care of by their loved ones at home. So my question is, can we use existing methods of identifying high-risk patients in those patient populations to identify patients who may be at risk for developing blood clots and may benefit from long-term, what we call primary prevention of blood clots? That question has never been quite asked and answered, and it involves a very large patient population. So in my view, that's one of the holy grails to be asked and answered. The other holy grail I hope to answer with the Merinoff trial, which is there a high-risk group of medically ill patients that would benefit from a strategy of extended or out-of-hospital prophylaxis? And if Merinoff is positive, it will have global implications. So I'm quite excited about that.
Very interesting. Now, I'm curious. Now, you mentioned a couple times these high-risk patients. How do you draw that line between who you think you should get the care and who's maybe only moderate risk or who's moderate to high risk? Where do you draw that line?
That is the million-dollar question, isn't it? And the answer is, I've actually spent the last 10 years of my research work in doing exactly that, using clinical risk assessment models with or without the use of biomarkers to exactly identify a high-risk group. So you hit the nail on my head. That has been my research focus for almost a decade now.
The question's keeping you up at night, right?
Absolutely. So I think we're coming much, much closer to identifying what these patients look like. And the beauty now is that we can then use these models and put them in an app. So for the first time now, my residents and my fellows using this app can go at a patient bedside, put the calculations in their app, whether they be in the Android or iPhone, and come up with a global risk profile for a particular patient. And we've never had that. That's very exciting.
Certainly. So do you think this app is going to be something that the public will have access to as well? So if I can identify myself if I'm at high risk and then seek help?
Absolutely. So this is available free of charge in the App Store and Google Play. So I think the key is now how to devise that app to make it patient friendly, because right now it's really devised more for clinicians and practitioners.
Sure.
But I do think with a little bit of tweaking, we can make it patient friendly as well. And again, our patients are getting more and more sophisticated. So I think they're really clamoring for apps such as these to self-identify their risk of disease.
Very cool. Well, great to hear more about these big questions that are in your mind right now. And Dr. Spy, we've talked about some different aspects of your career throughout our conversation today. And I think one thing that really helps people along their own journeys is advice from all the multitude of places you can get it. So is there one particular piece of advice that you received at one point that really helped you that you want to pass on to our listeners today?
I think the key is, and this is something that is discussed in World Thrombosis Day and in all the patient statements, is I think if you're to take home one thing from this wonderful conversation, it's this: know your risk, understanding your risk of getting blood clots. And to know your risk, it means that you've had to assess what your risk factors are and what the risk factors and diseases that you have that can contribute to these risk factors. So the one statement that I could really ask everyone to ask themselves is know your risk of developing blood clots. And knowing that risk and then understanding some of the subtle presentations, I think would put you forward in a very big way, especially, as I mentioned, in high-risk situations such as hospitalization or long flights or major surgery.
Certainly. Well, a helpful message to pass on to our listeners today, Dr. Spy. Is there any last note of inspiration you want to leave them with, or a last message you want to end this conversation on today?
Thank you for that. And I do. And I think what's exciting from a clinical researcher point of view is that we know a lot more about this disease than we knew even 20 years ago. What's exciting is that moving forward, we can start with greater and greater precision to identify patients at high risk of this disease and identify high-risk situations. And then more and more, we have a lot more drugs in our disposal to treat patients with disease or at risk of disease. So we have gone through what I'd like to call a revolutionary phase in the management of blood clots in the last 10 years. I think this should be very heartening for patients either with this disease or at risk for this disease. So we really are in a new threshold. And I liken that to the 1950s during what I call the dawn of the antibiotic era. Around World War II, we only had 2 or 3 antibiotics at our disposal. So very limited ways we can treat patients with infectious disease. After World War II and after the dawn of understanding microbials and antimicrobials, we really went into what we call the dawn of the antibiotic era, where we saw an explosion of antibiotic therapy that changed the entire public health of infectious diseases. I think we're reaching that point here with the disease of blood clots or thromboembolic disease. We're really reaching the dawn of a new era because we understand the disease a lot more. Now we have much, much larger anticoagulant or blood thinning drugs at our disposal to treat patients. And we're really entering the era of what we call patient-specific management strategies. So getting the right drug at the right dose to the right patient for the right condition. And that's exciting.
Absolutely. Well, it's a wonderful time to be in this field. Like you said, so many exciting developments going on right now. Now, it's been wonderful to chat about your work, but if our listeners want to learn more about what you do and about you specifically, where should they go or who should they contact?
I think what they can go is to the Feinstein Institute of Medical Research website. My profile is on that website, and they can contact me through my email in that profile. And of course, would love through other resources such as World Thrombosis Day and others to conduct patient chat groups as well.
Excellent. Well, listeners, definitely check out the website, learn more about Dr. Spy's wonderful work. And Dr. Spy, thank you so much for joining us on the program today.
It's a real pleasure to be here.
It was wonderful to chat with you, and listeners, great to have you here as well. We'll see you next time on another episode of People Behind the Science. Your voyage to explore the lives of today's exceptional scientists has just begun. You can find everything we talked about today, including our guests' favorite books, biographies, photos, and more, when you visit us at www.peoplebehindthescience.com. I look forward to chatting with you next time on People Behind the Science.